And so I kind of want to go over some of the things that the article talked about. And, I know we've talked about social media and the filters before. For those of you who have maybe seen those episodes, the gist of this is that you shouldn't allow these filters to make unrealistic expectations for yourself. I mean, these filters are amazing. I've farted around with them a little bit, and they're better for women. The ones for the men are kind of not as great.
I don't know of any ones for guys.
Yeah, I tried it. I mean, it doesn't really work as well. But I mean, I've done it, with women. I was like, hey, try this out, and it's like, wow, it's amazing. Like it really, just makes you not like a different person, but looks like yourself, but like a superstar model version of yourself, and they are pretty amazing. But the downside, of course, is that it can lead to unrealistic expectations if, for example, someone you look up to is using these filters all the time, and you think that that's their real life. And if you use them on yourself and then it makes you feel bad about yourself, I mean, that's obviously kind of a negative thing.
Yeah.
So I mean, you need to be careful with the filters and not allow them to push you to do things which may not be in your best interest. But as I said, the most important thing to me that she was talking about, and because I'm a plastic surgeon, is when the plastic surgeon told her no. And I think that that's an important thing for patients to think about when they're looking for a plastic surgeon, because and I hate to say this, and I seem like I'm always dogging my specialty, but I mean, somebody has to, look out for patients. But there are plastic surgeons out there that if you went to them and you wanted to do a procedure, whether you need it or not, they would say, sure, let's do that, right? I mean, because we're talking about thousands of dollars in a very, very highly competitive market.
Yeah.
And so, the important thing is, if you're picking a plastic surgeon, is you need to get honest evaluations. I mean, that is so critical to having a good outcome, because, for example, if somebody comes in and they want a procedure which really they don't need, and the surgeon goes through with it, there's a high chance that the patient will get to the other side of that and just not be satisfied with the results, because it's hard to tell.
Yeah.
And and even worse is when sometimes you'll find plastic surgeons that solicit you for procedures, because I have people come to my office and they say, well, I want you to tell me what I need. I'm like, absolutely not. My job is not to tell you what plastic surgery you need. If you tell me what you have concerns about, I can tell you what your options are.
You should be like, you need to go to therapy. That's what you need.
No, that's so mean. I don't want to make people mad, but no, I mean, I think a lot of people, to play devil's advocate, I am an expert in this, and so if I want to, I can look at someone and I can say, okay, that person could do this, that person could do that, and they could do this, and it would make a positive effect on what is the standard of beauty. But I just don't think that that's right. I mean, I feel like that, being an expert, you almost have undue influence on people, because if somebody comes in and I tell them, oh, well, you didn't know that your nose is crooked? I mean, you really need a rhinoplasty. I mean, that gets in like people's heads and stuff.
Yeah, but that's what I'm saying. Like I'm not saying that as even a joke. If somebody came into your office and literally said that, it's like they obviously have some type of like body dysmorphia. Like no matter what you do to them, they'll probably be like, I need more.
I mean, I don't know.
Because
I feel
now this lady looks like this, and I want to look like that.
Yeah, I mean, I feel like that if somebody says that you would potentially, just be on guard that they might be hypercritical of themselves. And I'm not afraid to tell somebody that they're hypercritical of themselves.
Yeah.
In a very polite way. And the way I say it is, if somebody comes in and they really feel like some part of them is really, really bad, and I don't agree. I mean, I just will flat out tell them, look, this is my job. I see people all the time. And I'm telling you that where you are now is not near as bad as you think it is. And that doesn't mean you can't have surgery on it, but I do think it's important for just the overall psychological well-being of the patient to make them understand that we are our own worst critics. I mean, I'm the same way. I look at myself and like, I used to be like a really, big athlete, and I'm just not really doing that right now. And I feel like I'm overweight. And I think that almost anyone would disagree with that. I mean, I'm obviously not overweight, but compared to what I was, 5 years ago, I'm not in as good shape, and I can see that, and it gets to me sometimes.
Yeah.
And so, anyway, as a plastic surgeon, I do think that you have an obligation to give honest evaluations, just because it's the right moral thing to do. I mean, it's difficult when someone says, "Here, take my money," and you have to tell them no. But I mean, as a doctor, you know, you took an oath to do what's right for the patient. And I'm afraid that that's not always done. And so as a patient, you know, what can you do to potentially protect yourself from that, right? So that's what I'm kind of getting to here is, you know, if you're a patient and you're looking for a plastic surgeon, you know, how do you know if they're looking out for your best interest as opposed to their best interest, right? And I think that it involves, one, potentially looking at what are the ways that you can get in trouble with that. Meaning, first off, like, so when would I tell someone no, right? So if I was going to tell somebody no, it usually revolves around if somebody wants too many surgeries at once. I mean, like somebody comes in and says, look, I want to do a tummy tuck, I want to do a breast aug, I want to do, you know, lipo on my flanks, and I want to, you know, take up some eyelid skin. I'm just like, well, you got to back off, because doing that much surgery at once does have risks. And that's not always the case. I mean, when we've talked about some of these really bad outcomes in plastic surgery, one of the, you know, factors that you commonly see is that these patients are getting 4 or 5 procedures at once. And so there definitely is a risk to it. So if somebody comes in and they want, you know, too many surgeries, I just will flat out say, look, even if I could do this, I'm not going to do it. It's too much for you. The recovery would be too much. It adds risk to everything. You have to break these apart.
Yeah.
And if they say, I'm going to go elsewhere, then I say, that's fine. I mean, you know, at the end of the day, my job is to keep people safe. And so that's one way I say no. The other is doing surgeries that have too much risk. I mean, you know, I'm against BBLs. And that's a little bit, I mean, it's somewhat controversial. I mean, there are plenty of plastic surgeons that think that they're not great surgeries. I personally just think that because the mortality rate is 1,000 times higher than the average plastic surgery, that I'm just not interested, among the other reasons. You know, so saying no to procedures that may not be standard of care, and BBL is definitely a borderline one. Things like, you know, butt implants or you know, higher up on the list of things that are not mainstream, you know, calf implants. Also doing surgeries under local. Yeah, I have a lot of patients that come in that say, oh, I want to have this surgery, but I want to have it under local. And I've done surgeries under local. I can do them. It's not that I don't have the skill set, but I generally have gotten to the point where I'm saying no to that. I mean, just like, remember the patient we talked about last week, the girl that died because the plastic surgeon called 911? That was a surgery under local, and as you remember, I thought that she probably died due to local anesthesia overdose. Now, that's just speculation. I don't have any data to support that, but it was a local surgery on a young girl that went into cardiac arrest. So common things are common, and that's, you know, very high on the risk. The other thing is when I don't think patients will get a good outcome, and blepharoplasty is a big one. I have a lot of girls that come in at 40 years old that want a blepharoplasty. I'm like, I think you're just a little bit too young to do this.
What is that? Is that just like
so like I don't think I'm really getting it yet, but I mean, it's when you get a little too much eyelid skin, and it makes you look tired. And so there's a very easy surgery to fix that. You basically just cut out the extra skin and sew it up, and it's pretty simple to do. But I get some people that come in that really are kind of early in the process of that. And you can repeat it, but generally you like to do things just one time. And so I sometimes will tell people, look, you're a little early for this. You know, maybe consider some sort of skin tightening that can, you know, help you out there. Liposuction is another one, you know, especially liposuction in the medial thighs, you know, or like the underside of the chin. That's a little gray area. I will do those, but I really talk very plainly to patients that I think that your result's going to be very minimal, and, you know, is the result going to be worth your time and your money? And I've had a couple patients I flat out told no because I just think that they would be unhappy with the results. And then a lot of them, it's almost like I'm trying to talk them out of it, you know, where it's like there's gray areas, right? I mean, if you think about liposuction, there's people that don't need it, people that do need it, and then everyone in between. And so the people in between are the ones I, you know, have a really kind of honest conversation about what my expectations are. Facelift and neck lift's another one. You know, people will start to age, get into their 40s, and they think, oh, I need to go get a facelift. I mean, that's a pretty big surgery to do when you're young. Really not something I personally would do.
What's like the youngest that somebody's come in to like?
Oh, I've had people in their 40s want facelifts. Yeah, absolutely. Like people my age, you know, or even younger. And I'm just like, no. The thing is if, you know, if they go down the street, someone probably would do it for them. But I feel like they could get an adequate result from some non-surgical method. I mean, like the lasers and stuff we use are actually really good at tightening skin.
Yeah.
Now, if you're 75 years old, they're probably not going to give you the result that you want. But when you're younger, they certainly
What's like the age you would recommend?
Well, that's tough to say. I mean, it really depends on the patient, because there are people who genetically will age faster, or say, for example, they were in the sun their entire lives, they're going to age faster. I mean, I'm not saying I wouldn't do a facelift on somebody in their 40s, but they'd have to be on the
meets the needs for it. I
right,
guess.
they'd have to be on the extreme edge of it.
Yeah.
And then, lastly, be something like a really big augmentation. Somebody that I got really on my soap. I was doing surgery this morning, and the scrub tech, Michaela, what's up, Michaela, if you're watching? She was telling me about someone that she knew that was going to get 800cc breast implants. And I was like, oh my gosh, that just...
What, is that like a double D?
No,
Like
that would be
F?
way bigger than that. Yeah, it'd be enormous.
Oh.
She was going to do a breast lift and get these 800cc implants. Like, oh man. I mean, there's just such a high potential for problems immediately and down the road. So anyway, as far as you as a patient, what can you do to make sure that your plastic surgeon is being honest with you, okay? And there are a few things you can do, and I think probably the easiest one is to seek multiple consults. It's odd for a plastic surgeon to say, I think it's a good idea if you seek multiple consults, but it is a good idea, because you want to make sure that the person that you're talking to is being straight with you. And well, how do you make sure of that? Well, you get a second opinion, and I encourage that in my own patients, because I like to spend a lot of time with my patients and talk to them, and so I don't feel like if they go down the road that I'm gonna lose a patient. And so if people have questions, then seek a couple consults. It's only in your best interest. Yeah. I do think another thing you do is make sure your surgeon spends time with you. If they're gonna take the time to listen to you and to go over everything in detail, then I do think that there's a higher chance that they got your best interest at heart. They're not just seeing you as a dollar sign.
Yeah.
So, and then lastly, ask a lot of questions. Ask about the downsides. If you're thinking about having surgery and you say, are there any downsides to this? And they say no, I mean, you should be concerned.
Yeah.
I mean, because any surgery I do, if someone asks me about downsides, I'm going to tell them what those potentially are. And it doesn't mean you shouldn't have the surgery. I mean, but every surgery you do carries potential downsides.
Yeah.
And
now that I think about it, whenever I went to my first consultation when I was 21 to get a boob jab, I brought 2 of my friends.
Oh, you did?
Yeah. And I remember them asking questions and being like, oh my God.
That's a good idea too. And that's a great idea, Sarah, is to bring somebody with you.
I brought my friends that they had no intention of ever getting anything done.
And they were kind of skeptics.
But it was almost like
that's
were just
really, really good idea.
They were there just to look out for me.
See, that's why we have you here. You have these great ideas. But no, that's actually brilliant and something I didn't think of. I mean, bringing... and some people might not want to do that because they're private or whatever, but if it's not a big deal, that is a good idea to bring someone to ask the questions you don't think of. Yeah. I know when I do consults, I try to answer anything that someone might ask, and that's why I spend so much time with my patients. Which I mean, it means I don't see as many patients in a day, but so be it. But I do think that it does show people that I'm willing to listen to them and make sure they're educated.
Yeah.
And I'm not saying that this is an advertisement for me. I mean, obviously, I hope people outside of this area watch the show. This is for anyone out there who's thinking about going and having plastic surgery, or if you have friends that are thinking about plastic surgery, use these things to make sure that your surgeon has your best interest at heart. Because as much as it pains me to say it, I know that that's not always the case.
Yeah.